Hi, my name is Mark. I'm a registered massage therapist and a registered kinesiologist at Strengthen You. Today we're going to look at a condition called Patellofemoral Syndrome. This is a condition that will affect the knee, specifically the patella. What we have is a problem with the tracking of the patella. Normally what you should have when you're doing any kind of leg exercises, when the knee goes into extension, the patella should track superiorly or move upward in a straight line. And then when you flex your knee, the patella should track inferiorly or downward in a straight line. With this particular condition, what we have is a tracking issue where the patella tends to track laterally. So as the knee goes into extension and the quadriceps pull the patella ends up moving out in a superior lateral direction like this, which often causes a lot of pain on the superior lateral side of the knee. This condition typically happens when we have a lot of overdevelopment of the vastus lateralis, or the large quadricep muscle on the outside. And we can also have a little bit of a muscle imbalance with weakness of the vastus medialis, the muscle on the inside. To take care of this condition, what you need to do is therapy is the ideal scenario. So to reduce the hypertonicity or excessive tension on the lateral side of the quadriceps, as well as to strengthen our vastus medialis, specifically the oblique fibers of the vastus medialis. To do the strengthening exercises, what you need to do is something called terminal extension. So what we need to do is have our patient or our client do a lot of knee extension exercises within the last 30 degrees of extension, along with the tibia being in an externally rotated position. So in a therapeutic setting, it would look something like this. So if I can have you lying down flat on your back, we're going to place the knee in a 30-degree flex position, and you can see we have the tibia, or the bones of the lower leg, externally rotated or turned outward. And then from here, what we're going to do is have our patient try to extend their knee or straighten out their leg against the resistance. As our patient is doing so, it is going to cause excessive amount of firing of our vastus medialis obliquus, so the fibers here, to offset that muscle imbalance. Another thing that we're going to do for therapy is we're going to reduce the tension in our vastus lateralis, the muscles on the side of the thigh, the front side of the thigh. This is going to happen with massage therapy treatment to reduce the muscular tension, as well as to reduce the connective tissue tension, or fascial tissue in the area. With this condition left untreated, you tend to end up with a lot of discomfort on the lateral side of the knee. Patients will experience most of the discomfort when doing weight-bearing activities such as squats or lunges or step-ups. It might even go into affect their activities of daily living, affecting their ability to move from a sit to a stand position, a stand to a sit position, up and down the stairs. Okay, so to treat this condition with massage therapy, I'm just going to raise your shorts. Is that okay? So we're going to expose the area. And typically what we would do is heat to the area to reduce some of the muscular tension. Once the heat has been removed, one of the key things we need to do is reduce the fascial restrictions here. Our fascial tissue is a connective tissue layer that surrounds the muscle. So we can do that by doing techniques such as skin rolling. This is often a little bit uncomfortable. The patient will often feel a pulling on their skin or a pinching sensation. And this will help to reduce that fascial connective tissue adhesion or issue or tightness. This would be followed by massage therapy, muscle stripping and kneading to the area along the lateral side of the thigh. Often is quite uncomfortable.
Is that comfortable?
Mm-hmm. And we will also want to do some sort of stimulating type of massage therapy work to the medial muscle, so your vastus medialis, and this will help to have this muscle increase in its firing potential. Typically this would be followed with that strengthening that we spoke of before, so strengthening our vastus medialis obliquus. So if you can extend your knee, good, and keep breathing. Massage therapy, physiotherapy, and chiropractic can also help by mobilizing the patella. So we said that we have a problem with the patella moving in this superior lateral direction. So part of what we're going to do is to mobilize the patella and push it in a medial direction. So you're probably wondering, how do you know when you have this condition? You're typically going to experience, like we said before, that pain on the side of the knee. That pain is most likely going to happen when you're doing weight-bearing activities, such as moving from a stand to sit position or sit to stand or going up and down the stairs. What you want to do is make sure you get it checked out by your regulated healthcare professional. This is quite a simple condition to bring some sort of relief to and alleviate the problem. So make sure you get that checked out. If you have any other questions about any other condition, feel free to comment down below. I'd love to share more knowledge with you guys. Again, my name is Mark Chioloy, registered massage therapist, registered kinesiologist. Thanks for checking this out.